Welcome to Generational Issues in Nursing. For the first time ever, there are four generations of nurses working together. This includes baby boomers, Generation X, Generation Y, also called millennials, and Generation Z. Having this generational diversity in a clinical work group provides a unique opportunity for each generation to bring its own talents to the work environment. However, having such diversity in the workforce can also create conflict. Unresolved conflict on the nursing team can lead to a loss of productive time, errors, staff turnover, and decreased patient satisfaction. So it is important that we take the time to educate ourselves on these different generations and learn how to work together. By understanding generational differences in nursing, we can improve patient outcomes, build a more cohesive team, utilize each other's strengths, support individual development, and ultimately enhance the workplace. Baby boomers are born between 1946 and 1964, and they're currently between 57 and 75 years old. The last baby boomers are set to turn age 65 in 2029. Baby boomers have a significant clinical and organizational experience, and they make great mentors and should be engaged with helping with succession planning. This means as they begin to retire, these nurses can foster succession planning by actively engaging Generation X and millennial nurses who will benefit from their wealth of experience. Ultimately, baby boomer nurses are known for their strong work ethic, optimistic attitude, and workplace loyalty. They prefer face-to-face meetings or phone conversations with open and informal communication. When they receive a text, they may use full sentences instead of abbreviations that are more favored by their millennial peers. The biggest challenges with working with baby boomers is that they are often cynical and lack tech skills. Generation X includes individuals who are born between 1965 and 1979, and they are between the age of 41 and 56 years old. Generation X is known for their independence, but they are also keen observers of their environment. They will bring creativity and innovation to solving problems. They are also outcomes oriented, which is an important skill in today's healthcare environment. While strengths include problem solving, questioning the rules, being productive, and relationship building, their challenges include problems with authority and their requirement for independence. Generation Y are often called millennials, and these are individuals who are born between 1981 and 1996. They are currently 25 to 40 years old. Generation Y are optimists and technologically savvy. They anticipate rapid responses, typically in the form of email or texting. They often use abbreviations and acronyms, which can be frustrating for older nurses who may not be familiar with this style of communication. This generation also grew up volunteering and are civic-minded. Strengths include that they are enthusiastic, they openly share their opinions, their technology expertise, and they accept divergent views. They also prefer a healthy work-life balance. Some challenges with millennials include that they have difficulty accepting feedback, they can be entitled, difficult to work with, and they are not very cost-effective. Finally, we have Generation Z. This includes individuals who were born between 1997 and 2012, and they are currently between 7 and 22 years old. This generation is just entering the workforce. The beginning of this generation is 1997, and this is the same time that the internet became publicly available. This is the first generation to have never known the time without internet. These digital natives spend most of their day consumed by technology. As a result, they're individualistic and can have underdeveloped social and relationship skills that may lead to anxiety, insecurity, and depression. This use of internet may lead to a short attention span and a desire for immediacy and convenience. However, this generation is amongst the most open-minded, the most tech-savvy generation, and they are very accepting of diversity. This picture shows the four generations working within the nursing workforce. We have our baby boomers born between 1946 and 1964. These individuals are motivated and hardworking, and they define self-worth by work and accomplishments. This is approximately 25% of the nursing workforce. Generation X, born between 1965 and 1980, are practical self-starters, but work-life balance is important to them. They make up approximately 40% of the nursing workforce. Generation Y, or millennials, born between 1981 and 1994, are ambitious with high career expectations. However, they need mentorship and reassurance. This is approximately 35% of the nursing workforce. And finally, Generation Z, born between 1995 and 2010. These individuals are highly innovative, but they expect to be informed. Their personal freedom is essential. Because this generation is just entering the workforce, they make up less than 5% of the nursing workforce. At the beginning of this presentation, we talked about why it's important to understand the generational differences within the nursing workforce. This slide shows some strategies for generational success. With baby boomers, management is best to find opportunities for boomers to share their experience, utilize their cost management skills, and give public recognition for their successes. Communication with baby boomers is ideal in open dialogue and face-to-face or telephone conversations. For Generation X, management is best to avoid micromanaging them and allow them to work independently. Also play to their problem-solving skills. Communication preferences for Gen X include direct and short conversations and emailing and texting. And finally, with millennials, management strategies can include to capitalize on opportunities for millennials to use their tech skills, recognize this generation's desire to share opinions, and encourage their enthusiasm. Communication preferences are that they are frequent and short, and they prefer texting or even Twitter. Understanding how each generation feels and acts in the workplace is essential to understanding the diversity within the nursing profession at this current time.